Hi everyone, welcome to episode 130 of the Veterinary Behaviour Chat podcast. And I'm so excited about this episode. I literally am. I've been looking forward to it for ages. And that is because I've got the wonderful Dr. Amber Batson here with me today. And we're going to be talking all things behaviour and GI health, which I know is such a big topic at the moment and something that we probably don't know that much about yet. Amber's got a huge interest in that area. So I'm really excited to kind of dive in to some of the things that we kind of know, don't know, definitely don't know, think we don't know, and all the challenges that come with trying to figure out, components of behavioral presentations as they relate to gut health. So welcome, Amber. So lovely to have you here.
Thank you very much for inviting me. I'm looking forward to it too.
Good. Do you want to give us a bit of a rundown of your career, because it's quite impressive, and just tell us a little bit about yourself and what you do, who you are?
Well, I'm not sure it's impressive. It's just long. I graduated from the Royal Veterinary College in London in 1999 and went straight into clinical practice. And that's why I'd say it's not really impressive. I've stayed in clinical practice all of these heading towards 27 years, basically. But I first got really interested in behaviour in the first year of graduating. Back then, in 1999, 2000, there was actually quite limited options for doing education in behaviour. I did what I could find available at the time, some distance learning through universities, some other things. And to be honest, I wasn't finding it scientific enough. It took me a few years to find something more scientific education that was coming out of the postgraduate masters that was offered by Southampton Uni for years. And that's when I really felt that I got into the science behind it all. But I've remained in clinical practice, and therefore, probably 95% of my work has been mostly clinical practice for the first 20 years, but was building in sort of 5 to 10% kind of behaviour element, whether that be in handling or in actual cases. And but then 2007, I set up my own education business, Understand Animals, which I still do, provide education globally for vets and non-vet professionals, predominantly on aspects of behaviour, but carried on working in clinical practice. And so that what I try to do, and has always been my real kind of desire, is to find this newish science that's coming out of all the universities, and that's just being published. And then it can take years for that to ever get down and disseminate into practical, can't it? And so I try my best to keep on top of that and grab what I can, and then bring that practically to animal behaviour as quickly as possible. And that's really what I set up Understand Animals up for, to bridge that gap between scientific publication and practical application. And so it was almost 10 years ago now, when I was teaching a aggression in dogs course, that I started to do part of my education about gut health. Because I was seeing some of the stuff that was coming out in humans and thinking, hey, that's got to be relevant for emotional, cognitive elements, of experience for the patient when their gut health is disrupted. And so I've been digging into the science in relation to that for about 10 years. And I find it fascinating. I find it is a real relevant part to a fair number of the cases I see, but I do feel ruling it in or out, or leaving a question mark over it is really important.
Yeah, no, I totally agree. And so first of all, I want to say something else, and that is I also graduated in 1999. So we've our careers have been exactly the same length, which is lovely. I love that. And I also really love what you said about bridging that gap between the science and the practical, because the science is great and we need that. We need as much of it as we can get. But the thing that's going to make the biggest difference, I think, is exactly, as you say, that translational piece from the science to the patient. So yeah, I love that, and I love that you also kind of then took that deep dive into gut health. So what would you say, like, what are some of the main links then between gut health and behavior? Like, how does gut health affect behavior?
So I think we could, I try and do, and certainly what I've noticed both in the kind of publications, literature wise, and also my own experience with the patients, is I would divide it into 3 or 4 categories. I would say that clearly pain can be part of the gut health thing, whether we've got reflux and we've got some sort of burning sensation, or we have got distension at times, gas, hypomobility, so reduced mobility. We've got all these different ways, and cramping, of course, spasming of the small intestine or intestinal tract, and so that is definitely got to be always considered as a component, and that is something which I think is really easy to overlook, and we might come back to later perhaps, because sometimes I see cases where there's been a consideration that this dog has got pain, and there's been a real focus on musculoskeletal pain. In fact, I can think of a dog I'm going to see again tomorrow. I mean, this dog, 2 years of kind of musculoskeletal investigations for severe withdrawal behaviors, behaviours, we'd call it apathy, just depression really in this patient. And very knowledgeable client. They are a behaviourist trainer themselves. And actually, but he's always had reflux symptoms, so what we would call GERD, gastroesophageal reflux disease or disorder, where he lip licks a lot, lip smacking, sits up in the night, hard swallowing. He's always had that. So about 3 to 6 months ago, we started to delve into that a lot more. And that dog, now we'll talk about some of the things we might do, but we've ended up making a big change with his diet. And he's off all his pain medications, and he was on a ton when he came to me. He's on all his pain medications, just on a different diet, doesn't have those symptoms anymore, and he's a different dog. He's flying around scent trials, agile, bright, so the pain really, and it's hard because there's a crossover between why we might see more musculoskeletal pain in these patients, and of course they're changing the way they move. It was something I recognized in horses. I used to do a lot of horse work, and something I recognized in horses a long time ago was back pain. And when I was palpating back pain, actually it ended up correlating quite frequently, clearly not all the time, but with ulceration syndrome, gastric ulceration syndrome, because these horses are holding their body posture to keep the tension away from their stomach. And I think we get that in dogs too. So there could be a whole reason why we might get pain. But then the other kind of main elements really would be inflammation. So if we've got a chronic inflammatory enteropathy, as we call it, systemic inflammation has been shown in laboratory models and in our understanding of other patients to have a substantial effect on behavior. Those inflammatory agents circulate the body, they can cross the blood-brain barrier, they can influence the way the brain works. So, emotional dysregulation, as an example, maybe some cognitive changes, those things can happen because of systemic inflammation. And the gut's a big organ, isn't it? So if a fair amount of it in small intestine or colon is inflamed, it's going to affect the systemic inflammation. So we've got the systemic inflammation element. Then we've also got this other thing which could happen independently of dysbiosis. So dysbiosis is we've got these millions of bugs in the gut, and they are doing lots of things. Now, of course, they're digesting food, but they are also producing chemicals, hormones, and vitamins, which themselves can influence the brain. And so if we get an imbalance in the gut bug population, then the products they're making are going to be unbalanced in that individual. So there's the dysbiosis element. Then, of course, then there may also be a nutritional component. That would be my 4th category, which is that perhaps if an individual can't absorb certain nutrients effectively, then they're not available to be building blocks for other things which are really important. So if we were to, I don't know, pick on, certain tryptophan, let's pick on tryptophan, why not? Tryptophan as an amino acid, if for some reason that dog cannot absorb tryptophan effectively, then we can't make the same amount of serotonin in the body because it's an essential building block. So there's nutrition as well. And, of course, if we were to do a Venn diagram, and don't we all love a Venn diagram, we'd get, obviously we'd get overlap in some patients, and they'd overlap in some patients more than in others. You know, you could have pain without dysbiosis. You could have dysbiosis without inflammatory enteropathy. You know, the nutritional element, well, is that, or does it always tie in with inflammatory enteropathies, or could it happen because of non-inflammatory enteropathies? So hopefully that paints a kind of starting picture.
Yeah, I mean, how brilliant. I love the way that you described that, but it just shows the complexity, you know, of it. And as you say, that the gut is a big organ and there's so much that goes on in it. You know, and then obviously, I think, you know, the four sort of big pillars that you've described are potentially, you know, causes of diseases, and then so you've got all the potential underlying diseases, whether that might, you know, be neoplasias or parasite infections or whatever else it is. So it is such a hugely complex field, which brings me exactly to my next question. Like, what are the challenges in identifying and diagnosing? So you've kind of mentioned the four pillars and the Venn diagram, and, you know, some patients might have one without the other. How do we even start breaking that down and figuring out which patient might have which components of some of those things?
So I guess obviously we're thinking about behaviour cases here, clearly, you know, rather than your perhaps non-behaviour patient in clinical veterinary practice, although I'm not sure those things are totally that separable.
Exactly.
Of course. Yeah. Of course. But you know, here we as the non-vet professional or vet professional, it's been raised that this dog has a behavior concern to their humans in whatever, or multiple behavior concerns. And, you know, so obviously the first thing we are always going to need is we are going to need a detailed behavior history. You know, we have to think about the whole life of that dog, starting from where they are now and then going backwards. That's the way I prefer to do it, because people want to talk about the now, get it off their chest. They don't want to start the conversation, I got my puppy when they were 8 weeks old, blah, 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 when they're thinking they bit the postman yesterday. So, you know, so I would always start where we're at and then work my way back. But we do need a good behavior history, because of course we're going to get hints in there about it. If I see a dog and I discover that they had a really, really poor start in life in terms of their habituation and socialization, because of their living environment was quite impoverished, maybe they were attacked by the other household dog multiple times. You know, actually, when I hear that stuff, then of course the learning that has gone on, the potential trauma as well for that individual, is far more likely to be the source of their dog-to-dog reactivity than, you know, than perhaps gut-related disease. Now, that doesn't mean to say that patient doesn't have gut-related disease, and of course that patient may have some gut-related disease which is also affecting their responses in certain circumstances. So it's not that we then ignore the gut, but the point is a careful behavioral history will give us an idea, well, how likely is it this individual's got, you know, kind of life experiences which drive their behavior, versus, well, they've got hints of that or bits of it, but there's something else. And so within that behavior history, I would always be encouraging both non-vet professionals and vet professionals to be thinking about, well, what about the rest of the life? What about the rest of their health? And of course, if we're a non-vet professional, that's not entirely our remit, but we can ask questions just to get an idea on what's their appetite like? You know, what other things do they do in relation to eating behaviors? So, you know, that I would have a series of questions which are linked specifically to GI related health, which I think are appropriate for anybody to ask. And that would, of course, include the appetite. It would include, is there any vomiting? You know, are there any signs of nausea? Are there any other signs of discomfort? So very specific questions. Do they lick themselves a lot? Do they lick their environment at all? Then I'm always interested as well, do they show any abnormal postures at any times? Do they do a lot of stretching? Do they sound uncomfortable? You know, like they're whining and pacing, or is there a lot of noise? Are they very flatulent? You know, those sorts of things. Then poo, you know, we've got to do it. We've got to talk about poo. Because, you know, we're animal owners, so we've got to have that whole poo conversation. And, you know, what is their poo like? You know, is their poo, and for me, I just, with clients go down there, is it easy to pick up with a poo bag? or not, and then if it's not, then what is that like? And that's consistent as well, because a lot of pet caregivers would say, oh, well, yeah, no, it is 90% of the time. Well, we accept that 10% of the time that it's abnormal. So what is that? What does abnormal look like? How marked is that abnormality? Could there be potential links? Somebody might say, well, it's only whenever, I give a particular kind of fatty chew, or maybe they scavenge some cat feces, or something along those lines. So, but we can dig into those questions, body condition score, weight, of course, may be very relevant as well. And if we are getting concerns about a number of those questions, or even one of those answers seems really abnormal, then we've got to think about gut health more. If I'm hearing none of that, if that's all absolutely perfect, the appetite is normal, they don't eat anything abnormal, they're not canine coprophagic, they don't have any pica, the eating of undigestible things, they're not licking themselves a lot or the environment a lot, their feces are always almost 100% easy to pick up with a poo bag, their weight's easy to maintain, their coat looks glossy and lovely, I'm not fly catching, I'm not absent staring, I'm not doing strange behaviors that have been linked with upper gastrointestinal pain, odd postures. Probably not the gut then. Yeah. We don't need to worry about that. But if those things are cropping up, then for me, and I know you've got your 7 M's, but then for me, this is then monitoring. Then, okay, we've identified that. How long do we think that's been going on for? And what's the intensity? And I tailor that to every patient. So depending on what the people have told me, then the things we monitor will be based around what they have observed. We'll go back to the withdrawn dog who is perhaps waking up in the night. Well, then that would be a thing. Can we monitor that? Each night, let's keep a diary. How many times did he wake you up? How long did the lip licking, salivating symptoms go on for? That sort of thing. If we're finding that they've got loose poo, well, let's keep a poo diary. And there are a variety of availabilities of described fecal scoring systems. And it doesn't really matter. You pick one that suits you and you use it. And as long as the client, so the client does the scoring because they're the ones living with the animal, and that's really helpful. And, and then of course, if we're then realizing, well, yeah, there's a consistency here. This isn't just a blip that's happened just this week, that this actually was going on some weeks ago, several weeks ago, maybe longer. Most of my patients, it's possibly been going on all their life. Right. And a lot of people who live with these dogs have never even considered the abnormality of that. Yeah, they've always eaten the bedding. They've always ripped open a bed that we give them and swallowed the stuffing and had loose feces intermittently. So we kind of thought it was normal for this spaniel, and it's like, oh, and so what do you do now? Well, what we do now is we don't give them a bed in their crate because otherwise they shred it up and swallow it. So I think we want to go how historical is some of this, and keep a diary over a period of 1, 2, 3, 4 weeks. Clearly, if there's marked symptoms, if there's vomiting, if there's weight loss, they're underweight, if there's really loose feces, we don't need to keep that score very long, do we? We need to investigate that.
Yeah. So let me just dig in here a little bit, because this is a really important piece, and I think everybody listening to this could really benefit from this. So I think you've just so beautifully described a number of different behavioral indicators that something might be going on. And what I love, Amber, and what I would love us both maybe to do, is that we've got our obvious ones, right? Nausea, vomiting, chronic vomiting, the poo, as you say, kind of the obvious things, also flatulence and, lip licking. Maybe some of those things are potentially a little bit more obvious. But I think there are so many things that are so subtle, but that are still so important. And I've got a couple of, and I think you've mentioned a lot of them already, but I've got a couple of like little ones that always just kind of, little red flag comes up when I hear them. And some of them, might not even seem that obvious. But to me, for example, change in appetite, although that might seem obvious, change in appetite, either way, whether it's increased appetite or decreased appetite, that to me is something that always raises a red flag. And then some of the right? And then because some people might think, oh, well, no, he's eating really well. But if they're ravenously hungry all the time and can't seem to put weight on, that might not register, and it might not be something that flags up. And then a few of
I'm
the
going
other
to stop you
things
there though, but even then, because I saw a dog like this on Monday, you know, and yeah, they're a Labrador, so of course we'll all have the kind of professional joke. Well, of course they're a Labrador, they're going to be hungry, yeah, and we appreciate, yes, there's a gene, you know, and some Labradors may have this gene where they don't get satiation, of course. But I saw a Labrador on Monday, and you know, this dog is that, of course, and we go, oh, of course, it's Labrador, ravenously hungry all of the time. This dog's overweight. Okay, and now just because that dog is maintaining their weight and they're hungry doesn't mean to say, and I'm not saying you were saying this, but it's important that we don't therefore rule out the fact that this dog may have a gut-related problem. Yeah. Now, this dog, the reason why the dog came to me is because the dog has got really intense arousal issues and always has had. He's 6 years old now, but when he was only 6-8 months old, he was flying around and grabbing and mouthing and biting, knocking people over, you know, and therefore he was behaviourally referred, and he's been on various medications, and, you know, those things have never really even responded well to medications. Now he's 6. For the last 6 to 9 months, he's had loose feces really regularly. His appetite has not changed. He's still ravenously hungry. You know, his weight hasn't changed. This dog, and he showed me on Monday, has diarrhea regularly, and he hasn't lost any weight. Yeah. So, you know, yeah, we've got to keep all of those symptoms in mind, haven't we? Those expressions of their inner state in mind, so that we don't overlook something. Absolutely, an appetite change would be a red flag, wouldn't it? But equally, we don't want to ignore the dogs whose appetite is consistently the way it is.
Yeah, no, absolutely. I love all of those things. So what would be some of the other little subtle ones? So we've got the obvious ones, and you've mentioned a few of them, but what are like the little ones that you think, okay, that's like, it's not like a smack you in the face, glaringly obvious sign, hey, GI tract. What are some of the other little ones?
Well, I mean, it's not really a little one necessarily, but really abnormal eating behaviors. So eating things that are not normal for the species. Dogs, although they have evolved as scavengers, so they take a wide variety of things, you know, in their diet, they are not by nature canine coprophagic, with the exception perhaps of a mum cleaning up her puppy's, you know, feces in a littering sense. So they are other species coprophagic. They do like to eat horse feces, or, you know, deer feces and rabbit, and, you know, and of course humans. Yeah, exactly. Because when we think that might have been part of their domestication, was the hanging around, you know, human settlements in order to clean up the fecal waste and the leftovers, as you know, these very opportunistic scavengers. So although that's grim, that's not abnormal. However, if they're canine coprophagic, then I'm definitely wondering, where's that come from, and could that be linked to gut health? And, you know, I have a large number of cases who come to me with quite marked canine coprophagia, and when we address their gut related issues that they do have, that canine coprophagia goes away. Okay. And it doesn't always in all cases, and that could be for a whole variety of reasons. I took on a dog myself, actually, from a large national dogs rescue centre many, many years ago now, who had a very long history of extreme canine coprophagia. And he was 12 years old when I took him on, and he'd been in the kennel environment, a shelter environment, for over 10 years. Okay. And he'd always been canine coprophagic for all of that time. And when I took him on, within 3 months, that dog was no longer canine coprophagic. Wow. Now, and, you know, and was that purely gut related? Was that stress related, the persistent stress? But we know that persistent stress actually has a negative effect on the gut and the gut permeability, the gut bug population. So, you know, these things are kind of two ways. Canine coprophagia, or eating of undigestible things. So one thing, plant eating. Now, dogs do nibble at plants, but, you know, at the end of the day, they're not horses, so they can't extract adequate nutrition from plants. Now, that doesn't mean to say that they wouldn't eat little bits of fresh growing plants in their day-to-day world, perhaps because they do it as an increased non-digestible item for their gut bug health, so like more fiber. Maybe there are bugs on there which are useful to them. They can smell them out. They know that that's useful. So there could be a whole variety of kind of herbal reasons why plant material is beneficial. But if they're doing a lot of it, and what's the context of it? So if they do faster exercise and then they have to stop and they are intensely eating grass, or if the client's really struggling to get them to come away from grass at times, you let them eat it for maybe a minute or two, and then come on, let's move on with the walk. If the dog goes, no, not really, and then dashes back to eat more grass, that's not really normal, to be honest. So, and of course, eating, as we mentioned earlier, bedding, toys, materials. So the swallowing of things that aren't totally normal to me is a red flag, really. And then there's licking. I mentioned licking. I think, the licking is really easy to overlook. And again, I saw a dog just earlier this week. And when I asked about those questions, oh yeah, they're first-time dog owners and they've got a 2-year-old dog. And when I asked about that, they went, yeah, well, probably 3-4 times a week, he licks the sofa where he's lying to the point it's soaking wet. That's not normal, and so licking the walls, licking the floor, licking bedding, if again, they might lick it occasionally, because I've got another dog and the lady says to me, well, she's got 2 young children in the house. There's probably toast crumbs on the sofa, right? So of course, if the context is, well, yeah, after breakfast, they're nibbling and licking at the sofa because, kids are throwing food around, then that's a normal context. But we want to observe that and make sure that is the context in which we're seeing it. But this dog, no, that's not, there's no children in the house. They're not eating on the sofa. The dog's licking the sofa for several minutes, multiple times a week. That's a red flag to me. So I think, those kind of eating behaviors, the licking behaviors, they're probably my bigger ones that I would see, which perhaps are more easy to overlook.
Yeah. I've got one more to add to that, and then we'll move on. And that is behavior at mealtimes, at or around mealtimes. How do they actually respond when food is put down? And again, I've had so many really interesting behaviors that I've seen in cases. And you're right, of course, it could be neophobia of the food bowl or something else in the environment. It could be an environmental factor. But sometimes, the kind of the classic sort of approaching or, not wanting to eat, or or even the other way around, that the kind of inhaling of food behavior, not just around non-digestible food items, but also behavior around food. I think that's another one that I often just do a bit of digging and question, and maybe even get some videos of, because I think that's can be quite informative as well.
Absolutely. And the way they behave after they've eaten. Okay?
Yes.
I mean, we had our Labrador who we lost last year. And when she was a young dog, I remember, she used to eat her food from her bowl in a more moderately normal way for a Labrador, young Labrador. And then she'd hide under the dining room table for about 15-20 minutes. And I was like, that's not normal, because this was not a nervous dog. The context wasn't there to do that. The other dogs in the house weren't doing that. She wasn't hiding away from the food. So we changed the way we fed her. We moved her to a wetter food rather than a drier food, and overnight it stopped. So the way they behave after they've eaten, because you get some dogs who do zoomies and they go really intensely manic, and some of those dogs, they might be doing that because they're uncomfortable after they've eaten. And similarly, actually, I suppose another one, which is another good, useful and interesting indicator, might be behaviors around toileting. As well. So, the same thing. I see quite a lot of dogs who get perhaps more intense cramping when they're due to pass a poo, and that creates a manic behavior. So they start running around or pacing or grabbing things and shredding things up at the time that they are close to defecation, or that their posture during defecation looks abnormal. They're spinning circles, they're whacking their front legs between their back legs to really enhance the arch in their back. And we, of course, then might we want to think, well, has this dog got a musculoskeletal pain, that they're uncomfortable in the physical posture? But there are some dogs I am pretty convinced are having pain in their gut or in their colon and rectum, and that's why that they're trying to just kind of get it out as quickly as possible, or wedge themselves into a brace position for that discomfort. So that as well.
I've seen that in cats as well, quite a bit.
Yes, yes, me too.
Yeah.
Yeah.
Right. Okay, I think we've covered quite a bit there. So signs to look out for, and that some of those kind of not quite signs. Let's dive into this next one, which I think is quite a big one. Giardia. Specifically, in regard to, what's your experience been with young dogs that have had Giardia, perhaps when they've been pretty young, and have then, as juveniles, maybe going into adolescence, presented with behavioral issues? And we all know that those are high risk times for behavior problems to develop or to come to the point where caregivers start to seek help for them. But yeah, I'm really curious about this one because, and I know there's a bit of research out there, and I know there are some recent studies out there, and I know that this is a topic that you've talked a lot about as well. So I just would love for you to share your thoughts on this one.
Well, I think what it does is it really highlights the complexity of the inner world. I think that's the thing. And so obviously, yeah, I mean, Giardia, you know, it's widespread in the environment, in the majority of environments, and dogs as scavengers are likely to put things in their mouths, which perhaps we wouldn't do so readily, you know, so they are going to be, you know, picking things up off the floor in the outside world. They might be drinking water as well, you know, from puddles and streams and things. So because Giardia is so widespread, it's, you know, they're at a, you know, moderate risk of picking it up. But of course, Giardia, like many parasites, it's not going to do very well if it kills off its host. So Giardia, you know, we have these different relationships, of course, you know, these what we might symbiotic type relationships. And, you know, actually there is some evidence that some of these internal parasites can have a sort of commensal like benefit, like a relationship with their host, because they actually do, and it sounds bizarre, bring a little bit of positivity to that individual. They've certainly got to find a way to survive in that individual without causing substantial cost to the individual, because otherwise they themselves as a species are not going to survive. So because Giardia is so widespread, because the way we are, you know, Giardia itself, and having some Giardia in the body itself shouldn't really be a disease or pathology inducing situation. And there's some evidence that having small populations or amounts of Giardia within the gut may be beneficial. So it may have this commensal relationship effect because it seems to boost the mucus lining of the gut. Okay, so when we see clinical disease associated with Giardia, vomiting, weight loss, diarrhea, significant abdominal discomfort, those kind of symptoms, then clearly things have got out of balance. That's the big thing. And of course, nowadays we very much recognize that probably comes in two ways. It either comes because the animal has suddenly acquired a very large amount of Giardia, so they've been overwhelmed. Maybe they drank from a water source that was quite heavily contaminated, and so they've just brought a whole wave in and they can't cope with that sudden peak of parasite. The other thing, which happens perhaps more commonly, is that the individual's gut health is not in the right state to manage the Giardia that's coming in. It can't keep that balance. So it's no longer a commensal relationship. There's a cost to the individual. And of course, that will happen if the dog doesn't have healthy guts in the first place. They don't have the right gut bug population. Maybe the mucus lining of the gut, the immune system within the gut is compromised in some way. Maybe they're systemically immunocompromised because of some other disease that's going on that's not directly gut related. But, you know, there's immunocompromisation somewhere between the gut and the rest of the inner body. And that's why we get Giardia. Now, if we wheel back, because you talk about, you know, young dogs in particular, of course, we're first timers. So when we think about acquired, you know, innate and acquired immunity, we need both of those things to manage something like Giardia. So when we're a young dog and we have had limited exposure, it is going to take time for us to develop the ability to keep that balance inside. And depending on what else is going on in that young dog's life and what other pressures and compromises or underdevelopment there may be at that time, then they may more easily get overwhelmed by the Giardia. And studies have started to look at this and started to go, well, actually, yes, Giardia in young dogs is happens concurrently alongside some shift in the gut bug population. Now, question is chicken and egg there, though. Are we picking the Giardia up on our testing because the individual is compromised already in their gut bug function, or there's a mild gut bug dysbiosis imbalance there, or has the Giardia itself caused it? And, you know, and so that's always going to be a question that at the moment we're still digging into and we're still asking about. The thing is, if we have too much of that, we can't keep that in balance, particularly when we're in our neurodevelopmental stages. So for a young dog, it's going to be a little bit breed and size dependent, but we're certainly talking that first 6 to 9 months of life, and we may well be talking up to 24 months in life. You know, recent studies looking at cognition development in dogs, sleep pattern changes in dogs has suggested that, you know, they're not out of adolescence and into adulthood until they're probably nearer to 2 years. So, you know, we're still developing in that time. And we've got studies looking at gut bug populations in young dogs. I think it was Alessandri's done that work, 2019, where they looked at some different gut bug populations in our dogs as they age. So, of course, because we've got that development as well, the ability to maintain that balance is there, but then that may be further disrupted by the presence of the Giardia themselves, because of the negative effect they can have. And they're going to have a negative effect because they're going to affect that mucus layer, they're going to affect inflammation, you know, they're going to affect perhaps the stress levels of the individual, because I've got to take action, so there's an internal stressor, a bit more cortisol, that has an effect on the gut health, etc., let alone the fact, of course, that if we see symptoms in them, we may complicate it further by changing their diet, or perhaps even giving them medications like antibiotics. We know that that is a really controversial thing to be doing, oral antibiotics, unless we're really clear the individual very much needs them, you know, systemically. So I think that's where we're at, and it's really probably tied in the dysbiosis and the inflammation. So it's probably both things come at the same time. And if they happen in the neurodevelopmental stage, particularly the adolescent brain is rewiring itself really rapidly, and you know, at that time, if we get an infection at that time with inflammation, dysbiosis, those gut bugs start churning out different GABA, serotonin, dopamine, short chain fatty acids, the things the gut bugs do, and there's some inflammation, then that has an effect on the developing brain, and then that may well give an individual a behavioral, potentially lifelong change.
Yeah. And I love the way you've explained that. And I mean, yes, that's kind of sort of a little bit how I had thought about it as well. But I've seen so many young dogs that have had a history of Giardia, more than just a coincidence, you know. So understanding that better, and yes, there are studies out there, and there are studies definitely looking at the use of antibiotics and, you know, the risk factor of developing chronic enteropathies as a result of having antibiotics during Giardia treatment, and so on and so forth. So I think we need to be really cognizant of that and understand how we can influence and mitigate and treat and so on and so forth. Yeah, it's an interesting one.
It is, and but it's very tied in with the gut health in general, and the kind of well-being state of that individual, their disease resilience, their immune system resilience. And it's all tied in together, isn't it? So rather than for me, my take out of that is, you know, if we're detecting either symptoms or Giardia on testing, as well as just focusing on the Giardia themselves, we must stop and think about the overall well-being and health status of that individual, because it's probably come from a kind of fragility or vulnerability internally, not just because they've picked up Giardia. And I think that then that helps us to kind of help the patient, support the patient, and reduce the likelihood of long-term issues.
Yeah, love it. So before we move on to treatment and what we can actually do, let's chat a little bit about how can we actually diagnose some of these things, because I think that's where, even though we have a number of diagnostic modalities at our disposal, I think truly understanding what's going on, especially in some of these sort of more subtle cases, the dysbiosis piece, that dysbiosis index, you know, the inflammation, how can we determine that? are there any lab tests that look at sort of bacterial composition, or what other kind of GI lab tests do you like to use? You found to be
It's a big question, and and so we'll cover a little snapshot here really. I would signpost a little bit. So there's been a new endorsed statement produced by the ACVIM, so it's just come out in the last month or so, 2026, which goes through it's actually a statement in relation to diagnosis and treatment of chronic inflammatory enteropathies in dogs. So I think, that's a helpful thing, particularly in the veterinary community, and you're thinking, oh, I've heard all of this, where can I go? Have a look at the ACVIM's recent statement. That's a really good starting point. I think what first we've got to do is one, be careful and mindful about, are we really thinking about this is coming from pain, and could it be coming from the upper GI system, compared to, do we think this is intestinal? Now, just because it's intestinal doesn't mean to say there's not pain, but my point is we're trying to get a hint of, is this more likely upper GI, or more likely small intestine and distal, so colonic, because and because that might give us a hint of where do we go first with our testing. Of course, if this dog I was talking about, lots of lip licking, regurgitation symptoms, blah blah blah, where am I going to go with that? I'm really going to be first thinking about the stomach and the upper intestine. Does that dog need an abdominal ultrasound? Does that dog need a gastroscopy, biopsies, etc., to look at the upper GI first? Whereas if I think it's more intestinal, we've got a really hungry dog, we've got the loose feces, the dog I mentioned, the 6-year-old Labrador the other day, then of course, actually gastroscopy is probably not going to be that relevant to that particular dog. So of course the vets need to have the best clarity they can have. Are we heading upper GI first, or kind of more intestinal first? And that would be helpful. But if we're thinking about the intestinal element, first things first that we would be considering is, do we need to do a blood test? Is there relevance for a blood test? Sometimes intestinal disease is the result of something else that's not right. So full clinical exam. Is the heart okay? Because, obviously heart disease can lead to chronic enteropathies. But also, do we need to do a full blood test to check, not just on the standard things like inflammation and things that we could look at, but also to consider the B vitamins, cobalamin, folate, what's the pancreas like, what's the liver like. So we might want to do, a blood test specific for those things. But then, of course, we may want to look at the feces themselves. Now, when we analyze the feces, we can look at, of course, pathogens in the feces. We can go looking for, is there Giardia? What are the levels of other items, things that could be in there? Have we got salmonella? Have we got overgrowth of Campylobacter? Those kind of classic pathogens that might need detection. But then pause. What's the overall well-being of the dog? Why are they out of balance anyway? Why might that have happened? So we've got that element, the pathogen perspective, detection, but then we've got analysis of the normal gut bug population itself. So we can go looking at that. When we look at that, the main way that we've been doing that at the moment is by doing an RNA test. So we're looking at the kind of type of the DNA, if we call it that, of the bacteria themselves. Okay, and in the RNA testing, so that's 1,6S RNA sequencing, that's what we commonly use. We can get those little bits of the genes from the bacteria and work out which bugs are actually there. We do need to be mindful that that is predominantly picking up on what bugs are in the distal part, the lower part of the gut. So it's not necessarily telling us representatively what's going on in the upper gut. So this is one limitation that we have with that testing. There's also one study that suggested they've got to be careful that we mix all the poo up, because the bugs that are on the outside of the poo might not be the same as the bugs that are in the middle of the poo because of water extraction. Of what goes on in the colon. So there's limitations in its own right, and we need to be mindful of that testing. So we've been able to do that, and by doing that, we've got a reasonable idea of what are the main gut bug bacterial populations that are present. And and if we are then finding that we've got almost an absence of one, or a marked difference in one from the other, that's typically what we refer to as dysbiosis. There is a dysbiosis index which has been looked at over, say, the last 7 or 8 years in a few different studies in dogs. Dysbiosis index tends to use the qPCR testing mechanism rather than the RNA sequencing. And so we can use that PCR testing. It's more expensive, but that's typically what dysbiosis has done. And what dysbiosis does is that it's basically specifically looking at some, because QCR, to do qPCR on all the bugs, it'd be a huge test. It specifically kind of looks at certain groups of bugs to go, well, how, kind of what are their proportions like and how are they proportionally to one another. So the dysbiosis index, which has been looked at in some studies, is different from other what we might call microbiome analysis, where microbiome analysis is using the RNA sequencing to look at overall what bugs are present. Okay, so just if we're vets, just be mindful of that, because dysbiosis index is a little bit of a different test than some of the RNA sequencing microbiomes. The limitation of those tests, apart from the things I've just highlighted, are the fact that that still doesn't tell us what those gut bugs are doing. Okay, gut bugs produce serotonin, GABA, noradrenaline, dopamine, short-chain fatty acids, vitamins, among many other things, which all play a role in the gut-brain axis. And we are not yet commercially at a point where we are looking at what we call that metabolome. What are the gut bugs actually producing? Sacchettino, I think that was last year, 2025. There's a bit of digging around. They were talking about dogs with fear and the gut bug analysis. So there's a bit of digging around in that topic in that publication. There, that's something that we still would ideally like to expand on, because just because one individual's got more fusobacterium than they've got, something else, firmicutes, or vice versa, doesn't necessarily mean that we might have a change in the serotonin or the dopamine or the noradrenaline. And this is where it all gets really messy. So I will sometimes use a microbiome analysis, the RNA sequencing. I might use the dysbiosis index in patients. But what I am doing is I'm using that with really to get a flavor of how abnormal does this gut bug population seem to be. Some of the companies that do the RNA sequencing test will then try and sell products. Then they'll say there's prebiotic or probiotics should address that. And they're doing it because, let's face it, we want to make a difference. We want to make it better. But of course, we could also say because they want to make money. I get that too. But there's always that motivation. But actually, many of them set up because, they did it because of the health and well-being of dogs. But we don't actually have those answers yet. We don't know that giving them certain prebiotics or probiotics will actually make any difference. So I'm not doing it because I think, if I know they've got this type of bug and not that type of bug, I can adjust adequately their prebiotics, their probiotics, or their diet. What I'm doing is doing it to get a real flavor of what's the degree of abnormality here, which often helps me think about how we're going to try and manage this. It helps the referring vet and it helps the client. Because if we get very little abnormality, that doesn't mean to say that it tells us dysbiosis is less likely to be part of the problem. It doesn't mean guts aren't the problem. Because we could be in an inflammatory state and have limited dysbiosis. We could have pain without inflammation and dysbiosis, or we could have a nutritional inadequacy here. So it doesn't rule gut health things out, but at least then I know that I'm not trying to get to change that biosis. So, obviously we've now recategorized the way that we think about chronic enteropathies, certainly inflammatory enteropathies. And we used to think about diet enteropathies, or they're called now food responsive. And that probably is the majority, but that's because the food also feeds the bugs and it changes the gut bug population. But of course, then we used to talk about steroid responsive. Nowadays, we call that immunosuppressant responsive. So IRDs, because it's not just steroids. And then we used to think about antibiotic responsive, and we don't call them that. And I have to look at my paper for this because I know it involves the letters M and R, but to say the name out loud still confuses me a little bit. Microbiota related modulation responsive. Okay, that's what we used to mean by AREs, antibiotic responsive enteropathies. What we now recognize is what we're doing is we're trying to modify the gut bugs, the microbiota in some way, and that so that might mean a fecal transplant. It might mean probiotics. It could sometimes, maybe, mean antibiotics, but perhaps ideally not. It could mean more short-chain fatty acids, which in effect are a form of prebiotic for some bugs. So, that we categorize them in those different ways. And so when we're thinking about that analysis, and then also we may have the other thing which has been looked at on the poo itself, as well as the bugs, might be other things that are going on in the gut. Like I said, we're not very good at the moment at picking up on certain, the chemicals themselves, dopamine or serotonin, etc. We're probably never going to be able to do that for various reasons. But we could think about calprotectin. That's been looked at. Calprotectin is a protein which is kind of a mixture of used white blood cells, macrophages and granulocytes, and that has been associated in dogs, if we've got higher levels of that, of evidence that we have an inflammatory process. So that perhaps starts to point towards we've got an inflammatory enteropathy rather than a non-inflammatory enteropathy. The problem is the commercial availability. In the UK, we don't have good availability of the fecal calprotectin. In other countries, we might have, so can we test that? It might be useful. But again, it hints at we've got an inflammatory issue. It doesn't tell us the cause of the inflammatory issue.
Yeah, that's what I was about to say. I think the calprotectin is actually a really interesting one, and it's something that I've been looking into more and more. Of course, here in the UAE, nobody can get anything, but I know that some of my colleagues in the US have been looking into that, and I think it's really useful to know that we might have an inflammatory process, but it doesn't tell us what the underlying cause is. So again, I think, like you say, for that signposting piece and getting that sort of, you called it a flavor of, what is it that might be going on, could be useful. But one of the things I think that's coming through loud and clear, just from sort of listening to everything that we've been talking about, really, is just how complex this is, and that it's just still a little bit messy, and trying to really understand truly what's going on so that we can make informed decisions is not easy right now. Would you agree?
It's not at all. But I also think that there are ways of improving gut health which can have a marked improvement on the animal's behavior. So I obviously, given that certainly in inflammatory enteropathies, but also those that might be linked with nutrition, the right diet needs to be tailored to that patient. So that needs some dietary trials based on whether we think it's inflammatory and what may be available. And, we might have done some testing to look at the, antibodies in terms of food responsiveness. Would that be helpful? Would it not? We might have done microbiome analysis. Oh, those gut bugs are bugs that, we haven't got many who are reliant on fiber. So would adding more fiber help or hinder? We can try to select diets a little bit more, but we can also just do it based on the history of the patient and what hasn't worked so far. So, changing the diet can be helpful, of course, and then making sure that we've got observations the client's able to make over the coming weeks of being on that diet trial to see what the impact is. And that would be physical symptoms as well as behavioral change, potentially. Right. Yeah. But then we've also got exercise. Now, we haven't got time to go into this today, but this bugs me enormously. Dogs evolved really to walk around their environment more than do anything else. They become hyperthermic, too hot really quickly. And so lots of intense exercise. It's not that an individual might not be able to cope with that, but it compromises the blood flow to the gut, and it compromises the amount of oxygen to the gut. So we can modify the exercise patterns of the dog if we're suspicious of gut health, and that can be a benefit. We can think about how much rest and sleep are they getting. Is it the right amounts? Because again, that is parasympathetic nervous system driven. It means the gut is in a particular active digestive state with adequate blood flow and oxygen supply. So having adequate amounts of rest and sleep is really important as well. And then we can think about stress. What other stressors are in this dog's life that we can minimize or help them cope with more effectively, because stress has a negative effect on the gut health. So if we look at potentially on the diet side, and obviously we're probably doing that within the medical capacity, and any other maybe supportive medicines that we could use, we've got that element. But we mustn't forget that we can look at exercise and stress and rest and sleep in ways that probably really will help that individual's gut health. So what are we monitoring in relation to their gut health? What are we monitoring in relation to their behavior? And if we are using medications alongside that as well, be mindful of that. There are medications that we might use, psychopharmaceuticals, which for some dogs will increase their appetite. I think predominantly the gabapentinoid categories, and also, of course, steroids. I know we're not using them as a psychopharmaceutical, but we might use them to treat, the inflammatory issue. We could look at, so budesonide is starting to get a little bit more attention because of the way it's absorbed and the way it works. And will that bring less symptoms of increased appetite? Jury's still quite out on that at the moment. But, think about if we're going to use medicine, what impact might that have that could impact on this dog behaviorally if they're already ravenously hungry, they've already got pica or coprophagia and those sorts of things. And then also other psychopharmaceuticals, particularly the antidepressant categories, we now know are having an effect. They are having that microbiota modulatory effect. Recent studies in humans have shown quite a substantial change in the gut bug population of people on fluoxetine, as an example. I'm seeing the same pattern change in dogs who are on fluoxetine, but obviously we haven't published data around that as yet. And that could be beneficial to an individual, but it might not be beneficial to an individual. So just being mindful of what medicines we're using, how that might affect the gut health. And obviously appetite suppression often comes with some SSRIs. You and I have talked about this quite recently. We just monitor that, be mindful that our medications might have an impact in a way that might impact the dog behaviorally as well as medically. And, then we just keep monitoring, making our changes, and then we can modify our changes according to how the dog is actually responding. We have got plenty of ways of considering all of that and therefore just helping the dog, even if we don't really fully understand the science.
Yeah. I love everything you've said. I love listening to you so much. I always learn so much, but I also feel oftentimes really reinforced, in the way that we're thinking about things and approaching certain things. So, and I have to say, I agree. I've also seen quite significant patterns with fluoxetine, with dogs on fluoxetine. And like you say, for some that might be really beneficial, and for others it absolutely won't be. And that last piece I think is crucial. Having a really good understanding that what we do, our medications, that whole iatrogenic piece, what we do may have an effect, a good one or not a good one. So I think that's actually a really great place to leave it, because we're almost at the hour, and we said we were going to do 45 minutes. But there's so much
wobbling on because there's so much to say.
That's it. There's so much to talk about. We could probably go on for another hour. But this is actually the perfect moment where we've left things to kind of do a little bit of a teaser for the fact that you and I are going to be co-presenting a case in the Behaviour Case Collective, and we've earmarked May. We're going to aim for the month of May. That might shift to June depending on how things go, but for sure in the next couple of months we're going to present a really cool GI related case together. So for anybody listening, if you're not in the Behaviour Case Collective, then now is definitely the time you should be thinking about that. So yeah, Amber, I can't wait for that. I'm really looking forward to it. I love,
because I can get to include all the references then as well, you see.
Yes, exactly. But we're going to definitely put a link in the show notes to the ACVIM paper that you mentioned, the guidelines. I'm also going to include in the show notes the reference to the Giardia paper, the fact that we shouldn't be using metronidazole, loosely said. And then I know you also provided me with a couple of references that I'll also link in the show notes.
Yeah, we haven't really talked about diet and how that itself can affect the microbiome.
Exactly.
So there's so many factors that we do need to consider. We can put in a link as well at just suddenly gone out of my head who it is. It's Hartman this year published the 2 case studies about Giardia and behavior in dogs. So Hartman 2026. So I'll give you that. I'll make sure we include that link as well, because
it's those.
It's it's the whole correlation is not causation, but it's the first publication we've really got looking at Giardia in young dogs and how it may have influenced their behavior. So that's a really good, having waffled on about that for so many years and done whole presentations on Giardia in dogs, it's a delight to have really a scientific focus heading that way now.
Yeah, Yay.
Perfect.
So lots
Thank
of
you
links.
so much for having me, because it's been a pleasure.
Well, it's been my absolute pleasure, and we're going to have to do a little bit of a repeat of this and dive even deeper. We'll maybe have a chat about that, but yeah, and we'll do the case together in the Behaviour Case Collective. But thank you, Amber. It's always such a delight chatting, and yeah, I will see you very, very soon. And to everyone listening, thank you for tuning in, and we're going to see you next week. Well, I'm going to see you next week for episode 131. Bye for now.